angioplasty takes a little longer than a coronary angiogram, and the duration depends on the number of blockages, the complexity of the blockages, and whether we have to use any accessory equipment to treat the blockage, because not all blockages are the same and some may require more advanced techniques to treat the blockage. But I typically advise my patient a coronary angioplasty can take anywhere 30 minutes to 2 hours, depending on the number and complexity of the blockages. And again, it's done while the patient's completely awake. If the patient's nervous, and some patients are, we can give them a medication to relieve their anxiety. But again, it's done with the patient completely awake and does not require a general anaesthetic. The risks involved are more than an angiogram, because we are introducing equipment down the arteries, and that by definition entails some risk, and when we treat the blockages there is some risk associated with that. Depending on the complexity of the blockage, we typically quote between 1 and 2% of a serious complication, and by that I mean a heart attack, a stroke, or even fatality during the procedure. It's still low risk, 1 to 2%, but we oblige to tell the patient of those risks. We have to thin the blood as part of the preparation for the body to receive a stent, and with the blood being additionally thin, that can lend itself to bruising and bleeding complications. So we quote a slightly higher risk than for an angiogram for bruising and bleeding complications at the access site, whether it be the radial artery in the wrist or the femoral artery in the groin.